Hi girls. Um, in the previous video, I have spoken to you about the 8 specific paraphilic disorders outlined by the DSM, and we will begin with one of these disorders called as the fetishistic disorder. Fetishism is a form of paraphilia, a disorder that is characterized by recurrent, intense sexual urges and sexually arousing fantasies, generally towards non living objects, or a highly specific focus on body parts that are generally not considered erotic to obtain sexual satisfaction. This could be a foot or a toe or a hair. These body parts are generally not considered erotic, but people with fetishistic disorder seem to derive sexual gratification from such body parts. Here are some of the facts about fetishistic disorder. The reported cases of female fetishists are extremely rare. In the context of consensual sexual relationships, fetishism do not normally interfere with others. Like in the previous video, I told you this is one particular disorder where the person is not causing harm to any other person, but there may be partners who are unwilling because they may not share the same erotic fascination for a particular fetish object. In that case, we cannot or the particular person who has such fetishistic obsession cannot force his partner, but if he does so, then there is intended harm. And as I also told you that there are a few set of people who do not feel any distress over it, but here we will be making a diagnosis when there is this person is having considerable distress, having a fetishistic disorder. There are even reports about people, men who feel extremely ashamed of their fetishistic desires, and they even go for chemical castration, but rather than telling their partners about it. Fetishism occurs frequently in the context of sadomasochistic activity. Paraphilias generally occur in relationship to other paraphilias, or it can also co-occur with axis 1 disorders. So you will see that this sometimes happens in relation to sadomasochistic activity, and this particular disorder is relatively very rare among sexual offenders. Okay, so what becomes a fetish object? While any object may become a fetish, like a rubber teat, a leather garment, catheters, silk handkerchiefs, baby cot, etc., many men show strong preferences for paraphernalias that has connection with sex or sexual gratification. Paraphernalia, the term generally refers to articles or equipments that are required for a particular activity. Now, since it's a sexual activity, they may show some preference for objects because of its connections to body parts or involvement with sex itself. So it could be sexual objects closely related to human body, such as shoes, gloves, stockings, slippers, underwears, or even body parts such as feet, toes, and hair. Some men even go to the extent of committing burglary, theft, and even assault to get the object. In such cases, the criminal act itself typically reinforces sexual stimulation and sometimes constitutes a fetish. So the sexual excitement and gratification is obtained by stealing the object that they desire rather than the object itself. The object itself is of little importance in this kind of people with fetish, this kind of a disorder. Okay, so there are this particular slide lists the different types of the modes of using the objects, and there are considerable individual variations in how people with fetishistic disorders use fetish objects to obtain sexual gratification, and I have outlined them. Okay, this slide gives you the diagnostic criteria outlined by DSM for diagnosing a person with fetishistic disorder. Point number 1, the person should have such recurrent, intense, sexually arousing fantasies, urges, and behaviors lasting for at least 6 months, and these fantasies, sexual urges and behaviors should cause significant distress or impairment to social, occupational and personal functioning. And the fetish object are not articles of clothing that is used in cross dressing, and are not designed for tactile genital stimulation such as a vibrator. Okay, so when you look at the causal factors, generally they say paraphilias tend to have its onset during puberty, but for this particular case of paraphilia, that is the fetishism, you can see cases prior to adolescence itself. Experts believe that early childhood experiences could cause a person to have such fetishistic desires. The role of conditioning cannot be ruled out. See, let's say for example, a child has been exposed to an object that is associated with some powerful form of sexual arousal or gratification. Like say the child is being exposed to a pornographic magazine with women wearing undergarments, and later let's say the as an adolescent, he has his first sexual experience looking at those objects. Formerly a neutral object comes to elicit a sexual response due to its association with sex and sexual gratification. So we cannot rule out the role of conditioning in the development of fetishistic disorder. Behavior therapy shows that a child could be a victim or could be an observer of an inappropriate sexual behavior, who later imitates that inappropriate sexual behavior and then becomes reinforced by it, and this can also lead to the development of fetishistic disorder. Okay, it is also hypothesized that individuals may be deprived of normal social sexual context and therefore seek gratification through less socially acceptable means. So the deprivation of normal sexual experiences can also make people go for such fetishistic obsessions. Finally, some experts have suggested that men who have doubts about their own masculinity, potency, and who fear humiliation and rejection can also develop fetishistic desires, in which the individual may be able to safeguard himself from the feelings of inadequacy. So these are some of the causes that are speculated for the development of fetishistic disorder. Treatment, a lot of treatment have been in vogue, and there have been some success with drugs that reduce compulsive thinking that is associated with these people kind of tend to ruminate or think a lot about the fetish object and all of that. The fantasies need to be brought down basically. So drugs that reduces compulsive thinking and also the sex drive can help people. And cognitive behavior therapy has been very successful in treating people with fetishistic disorder. Aversive conditioning, okay, which involves using negative stimuli to reduce or eliminative behavior, is extensively used. One such approach is what we call as the covert sensitization, in which a person may be presented with a visually pleasant and a relaxing image of the desired sexual behavior, followed by something that is very negative. This can happen either in a visual imagery technique, or the negative stimuli can be something real, like that is a person may be made to imagine a very relaxing or a very pleasing visual image of his sexual act, and then it could be followed by the therapist pumping a foul odor into the air, wherein the person now starts to associate the act with something that is not so pleasurable. So such techniques have been useful in treating people with fetishistic disorder. So this brings us to the end of this video. We'll look at the next one, which is transvestic disorder, in the next video. Thank you.